Thank you very much, Simon sir, Satansu sir, for inviting me in this, the coin session. So I'm going to start my presentation, and the presentation is about diagnostic investigations in ocular trauma. I'm from Tilganga Institute of Ophthalmology, Kathmandu, Nepal. So yes, I'm going to start now. I'm the medical retina consultant working there. So this is my financial disclosure. So imaging is necessary to assess the extent of injuries because of the surrounding periorbital soft tissue swelling and other associated injuries, and also because at this time of acute trauma, physical examination of globe is difficult, and patient cooperation is also limited by unresponsiveness, altered meditation, and sedation. There are various imaging techniques like plain X-ray, ultrasound, both A and B scan, and now UVM, computerized tomography scan, CT, MRI, and optical coherence tomography. Yeah, so I'll go few slides in each. Plain radiograph has about 64 to 78% of sensitivity of orbital fractures, but this value is much lower for soft tissue injuries assessment. It is the first step for metallic foreign body due to its accessibility and low cost. For direct visualization, there are two exposures at right angle, AP and lateral view can be taken. As you can see, there is a radio opaque body in left orbit. And this is quite old one, probably new, doctors and residents might not know about this limbal ring. For localization intraocular foreign body, X-ray is taken with, this is the metabolic ring, contact lens with radio opaque marker over cornea. So, and then the distance can be measured. So advantages, documents the presence and number of metallic foreign bodies in the eye or orbit, defines orbital wall and skull fracture. It is very cost effective, and medical, legal, and documentary role is important. However, this is less specific in foreign body localization, cannot identify reducing foreign body, fails to show the existence and extent of penetrating or blunt trauma. So next one is ultrasound, where it is non-invasive, inexpensive, and non-ionizing, easily performed imaging technique, useful for evaluating eyeball measures, layers, and contents. It's 98% sensitivity for localization of detecting intraocular foreign body. So you can see this is the B scan, this is the A scan, this is the foreign body there, and this is the large spike. Next one is A and B scan. This is B scan, this is A scan of the vitreous hemorrhage here. And this is dislocated lens from B scan, ultrasound B scan. B scan showing this is the RD, this is the optic disc which is attached there, and this is the large hemorrhagic choroidal detachment by B scan. So what is the advantages? Advantages are useful in opaque media, detects and localizes radiolucent foreign bodies, lens position and zonal integrity can be noticed, and intraoperatively for the primary repair also it is useful. However, disadvantage, difficult to localize deep-seated foreign bodies, difficult to perform in open globe injuries, extraocular muscles is not clearly defined, and limited visualization of optic nerve and retrobulbar structures, or detections of scleral ruptures. Now, another one is ultrasound B microscopy. It is an imaging technique that uses high frequency, while in the normal A and B scan is 10, this is 50, megahertz sound waves to produce high resolution cross-sectional images of anti-segment to the depth of 5 millimeter. In cases of trauma, it can visualizes the angle structures, zonal dialysis, hyphae mass, scleral laceration, and lenticular foreign bodies. Next one is the computerized tomography scan. It is considered the best imaging modality in ocular orbital trauma because it assesses intracranial, facial, and ocular structures. It is available imaging option in most of the emergency services in main hospital. On enhanced orbital CT is the first choice to evaluate orbital trauma. Vascular injuries are suspected, then we need enhanced CT. And when also in blunt or penetrating trauma. As you can see, this is the CT scan suggestive of open globe injury. This is a loss of wall contour, fat tire sign, scleral discontinuity, and intraocular air or intraocular foreign body can be seen. Is the first choice when metallic fragments are suspected. Here you can see there. It is sensitive, it is less for glass and wooden materials where we need MRI. It can appear as hypoattenuated structures that can be confused by air bubbles sometimes. Advantages, it detects soft tissue injuries and orbital wall fractures precisely. Easy recognition of intraorbital and intraocular air, clearly defines most radiolucent foreign bodies, exact localization of foreign bodies, simultaneous examination of brain and CNS can be done, and enhanced one can be used for suspected vascular trauma and also detects optic canal fractures. However, it can, like multiple clustered foreign bodies may be missed, fails to delineate wooden foreign bodies, and thick scan can sometimes miss metallic foreign body. Next one is the MRI, is indicated to visualize is contraindicated when intraocular foreign bodies suspected. Next one, so this is the MRI scan showing foreign body. And next advantage is this, definitely it is mainly for the soft tissue injuries, and OCT is powerful imaging mainly for the evaluating macular trauma. Detailed images of anatomical structure of the eye is, it provides monitoring, especially for the macular and choroidal pathology changes, particularly in acute traumatic maculopathy. So this is the, this is following
Sir,
blood
please
trauma.
conclude. Time
Yeah.
is up.
So ocular trauma is one of the most common reasons for ophthalmic consultation. Ultrasound is non-invasive. CT can detect many orbital and it can be used for bedside ophthalmic examination when bedside examination is limited, and MRI is important modality in specific circumstances.
Sorry to interrupt you, doctor, but
That's
these
fine. Thank you very much.